Dr. Masek has been using Cerec CAD/CAM technology for over 20 years to provide excellent care for his patients. Large silver mercury fillings sometimes cause teeth to have large cracks or recurring decay. Not only does Cerak provide beautiful, long-lasting repair of damaged teeth, the procedure is usually completed in just one visit. The process begins with the diagnosis of the problem and a treatment plan to restore the tooth back to normal function. Cerak restorations are an excellent choice when a significant amount of natural tooth structure is lost. Frequently, the first step in the restoration process is to place a rubber dam that isolates the teeth being cared for. The rubber dam helps to reduce or prevent exposure to the mercury and debris being removed. And it helps to manage the water generated during the process so the patient does not have to swallow it. The second step is to remove the old filling material and any decay that is found. Dr. Masek then prepares the tooth to receive the new restoration. Next, an opaquing powder is applied to the tooth so that the Cerec camera can capture the preparation details. Dr. Masek uses the Cerec program to create a three-dimensional model of your tooth, which he will use to design the new restoration. The Cerec program generates a three-dimensional proposal, which is modified as needed to fit the specific tooth and bite situation. Once the design is complete, Dr. Masek chooses the correct size and color block from which the porcelain restoration will be milled. The Cerec milling device will then make your new porcelain restoration in just a few minutes. The proper size block is inserted into the milling shaft. Then the milling machine calibrates itself. The tools begin to move and locate the block. Once calibration is complete, the water for lubricating and cooling flows and the milling begins. The milling burrs work from both the outside and the inside of the restoration at the same time. The chewing surface is carefully detailed at the same time as the inside is shaped to fit the tooth. Step by step, the restoration begins to take shape and form. Just like a sculpture. Just a few minutes later, as the milling process nears completion, the burrs cut the restoration from the block. Your beautiful new Cerec milled porcelain restoration is now ready for fitting and for Dr. Masek to apply the finishing touches. The milling remnants are removed first, and then the restoration is fitted to the tooth, and final shaping is accomplished. Complete seating of the restoration is then checked. The next restoration is then inserted into its corresponding tooth. The fit is also verified, and then any bite adjustments are completed. The fit of all the milled restorations is then confirmed, and the characterization process is begun by first steam cleaning the restorations. A variety of porcelain materials are prepared and evaluated for color modification of the restoration. The materials are mixed and a glaze is then applied to the entire surface of the milled porcelain. The appropriate colors are then added to create a natural blend to the original tooth. The glazed restorations are then placed on a firing tray and inserted into a porcelain oven that fuses the glaze and the colors. In just a few minutes, the cycle is complete and the red-hot restorations emerge. After a few minutes of cooling, the beauty of the porcelain is revealed. The completed characterization of the restorations have the appearance of the surrounding natural tooth. The restorations are then prepared for cementation. They are treated with a bonding agent. The natural tooth structure is conditioned, and a bonding agent is applied. Then the restorations are cemented into place. Excess cement is removed, and the bite is checked. Sometimes a computerized device called T-scan is used to be sure the bite is correctly balanced and adjusted. Cerak restorations are an attractive, strong, and non-toxic alternative to unsightly silver mercury fillings, and most Cerak restorations are completed in just one visit.